you as a community. So please give us a call right now, 877-838-5292.
We know that there's a lot of uncertainty going on right now, and if you are impacted by this and you are uncertain about your finances, please don't call. Please take care of yourself first. But if you have the ability to support the station, it is an extremely vital time to do so. You know that we are going to be working with a small team here. You know that we're going to try to do as much of this from home and work remotely as we possibly can. But you know that we will still be here for you. You may not hear us continuing to ask you to call 877-838-5292, but write the number down. You might be motivated to do so later. And keep in mind that you can always make a contribution at KAWC.org any time of the year. So visit us at KAWC.org, make that contribution. And odds are you've already been to the website recently. Lou, I mean, how many visitors have we had lately?
Oh my goodness. I was able to share a report yesterday that showed that we were up over 1,400% since this time last year, and over about 800% since this time last week. So we know that people are hungry for information. I would say that the majority of those hits are on our breaking news page that is constantly being updated with the latest information. But it's also all the other coverage that we've been able to bring. Those posts are getting hits in a way that I've never seen before. I know that people are hungry for this information.
We have, the last number I saw was yesterday afternoon, and it was 25,000 unique visitors in the past week. That is huge. And we also know that if 25,000 people are visiting the website, odds are they have all listened to the station. Many of you are listening right now. If 1 in 10 of our website visitors made a contribution of $50 or $100, it would mean so very much to support and empower this team to continue to serve you. Call us at 877-838-5292, or make that contribution online at KAWC.org.
And actually, Jim, I'm going to send you down the hallway to actually post the Facebook link for Facebook Live, since I was trying to do it from my phone and I'm unable to do that at the moment. But we have a coronavirus press conference coming up from the city and county, and we will be carrying that live as soon as they do begin that. So obviously, we're not here for the endless pledge break. We're here because we want to make sure that we cover that story live. And Lou, I think a question I have for you is that as the news director, putting your news director hat on for a moment, what kind of stories do you want to talk about with the coronavirus?
I'm most interested in how people are reacting. I'm most interested in how people are living and what they're thinking. The information, quite frankly, the factual information about the virus, I believe, is accessible. I believe that we've provided the appropriate links on our website to the CDC, to the state health page, to the county health page, to the city health page, to the college health page, and some other John Hopkins research page. I think we've provided you a way to get the factual information. I'm interested in your experience of this. I'm interested in the next couple of weeks and months of your experience with this. I've heard people say, I don't know that this is true, that this will affect everyone. We will all know someone who has coronavirus or will be affected by coronavirus in the end. Okay? That's significant. I want to know how that affects our lives. I want to see how this shapes our community, our country in the days and weeks to come. I have to say, so far, I'm so proud of some of the reaction I've seen, both in our community and outside of it. There are needs, though, and even though I'm supposed to have some objective hat here, there are needs out there. There are people who cannot go to the store, who need their groceries delivered. There are people who cannot go to school online because they don't have reliable Wi-Fi or a reliable computer. I've heard of students working on their phones to get their papers done. We can solve these problems together. We can find resources together. We can share what we have to help these people get through this time. They are as uncertain about their futures as we are about ours, and yet we know exactly what challenges they face, and we know exactly what solutions are in place that would make it easier for them. We need to find a way to get together and make sure that all of these people's problems are solved, that are simple that are simple like that. It's so simple to put a group together that will deliver groceries. It's so simple to put a group together that has some extra computers that they might be able to loan to some students. It's so simple to help your neighbor. You don't have to touch them. You don't have to get very close. You just have to call across the street. Our